tretinoin, it can be a right pain in the but undergoing a tretinoin journey may possibly be one of the best things that you ever do for your skin. Its anti-aging benefits and its abilities to quite literally turn back the hands of time puts it up there with one of the most transformative products you could ever use. But remember what I said, it can be a right pain in the until it gets to know you. So stick around for this video where I'll be giving you my top tretinoin tips to help you know what to expect. If we haven't met already, my name's Belle. I'm a skin clinic owner and skincare enthusiast based here in the UK, and I help people achieve healthy skin at any age. And I do that by advising people on the correct products and treatments for their concerns. And this channel is a place where I can share some of my knowledge with you. So if that sort of content sounds like it could be useful for you, then hit the subscribe button below. And with that said, let's get into today's video. So a question a lot of people ask is, what is tretinoin? So tretinoin is part of the retinoid family, which is an umbrella term to describe prescription and over-the-counter versions of vitamin A. And retinoids come in different varieties and different strengths, and are used to effectively irritate the skin on purpose, causing the cells to die more rapidly for then the new cells to regrow and reproduce more quickly. Now, I won't name them all in this video, but I'm sure the common retinoids that you have heard of include retinol, retinaldehyde, adapalene, and of course the one that we're focusing on today being tretinoin. With tretinoin being the strongest topical retinoid you can use on your skin because of its transformative abilities. And you'll see it cropping up in pigmentation reduction systems, anti-aging systems, and even anti-acne management systems, with tretinoin for acne skins being particularly beneficial in some cases. It can come in different formulations, such as tretinoin gel or cream, and is prescribed also in different strengths, from 0.025 to 0.05 to 0.01, depending on the type of skin it's treating. Typically, a tretinoin 0.025% is to cause less purposeful irritation, so more for a more sensitive skin. A tretinoin 0.05% is most commonly prescribed for more normal skins, I'd say, and a 0.01% is prescribed for skins that require more corrective work. But there's one thing that tends to put so many people off when it comes to tretinoin, and that is the idea of skin peeling, or more commonly known as tretinoin peeling. But this is so normal, and it evokes such a positive response because it's literally your skin telling you that the tretinoin is working, making the cellular changes that it needs to make in order for the skin's health to improve. Normally the peeling is at its most intense around the 4 to 6 week mark because this reflects your skin's cell renewal with your skin adjusting to it. However, the peeling can creep in again if at any point you do introduce a higher percentage of tretinoin. But the peeling represents your skin shedding away the dead layer that it just simply doesn't need. And my advice would be, rather than just focusing on the journey, take a look at the destination that it could lead you to. Here is a fantastic example of tretinoin cream 0.05% before and after result from just using it for 4 weeks, and I'm sure you'll agree the difference is incredible. And this client used the Obagi Medical range, which is a brand I personally work alongside. Here's another client example of a tretinoin result after just 4 weeks, and this client used the 0.01%, so a slightly different strength, but with one thing in common, I'm sure you'll agree, being a visible improvement in the tone, texture and skin quality. Another thing to quickly touch on, as well as the tretinoin peeling, is when tretinoin is introduced into a skincare routine, a lot of the time it does cause redness. And here's an example of a typical reddening reaction, and this happens because of the activation of new cells, as that also further stimulates the blood circulation. But again, these things are temporary and will subside whilst the skin adjusts and strengthens over the time of the treatment plan. It's important to say that tretinoin is a prescription product, so it can only be prescribed to you following a consultation or assessment with an accredited medic or medical clinic. As well as this, it does really need to be supported with a healthy skincare routine and of course a daily use of sunscreen. It's a product that should only be used alongside an evening skincare routine, and depending on the skin and the concern that it's aiming to treat will depend on its usage. However, I would strongly recommend to visit a skincare professional or a medical professional to give you the advice that you need, as they will have the knowledge to know when to incorporate it into your skincare routine. but by using it correctly, my gosh, could it be a game changer for you. More on tretinoin next week, where I'll be showing you even more amazing results and also talking to you about how tretinoin and hydroquinone arguably are the ultimate skincare partnership when it comes to life-changing results. I'll see you next week.